Hello and welcome to Skincare Confidential, a podcast supporting the Science of Skincare Summit, an annual educational conference occurring in Austin, September 5th through the 7th, 2025. My name is Dr. Ted Lain. I am your host for today, and I am so pleased to introduce my guest, Dr. Michael Gold. Dr. Gold is owner of the Gold Skincare Center and the Tennessee Clinical Research Center in Nashville, Tennessee. He is also the co-founder and co-director of a wonderful aesthetic and medical conference called Scale that occurs in Nashville every year. In fact, this will be your 20th year, so congratulations on 20 amazing years.
Thanks. It's a pleasure to be with you on this. Scale started with 20 people, right?
Yeah.
20 years ago, and we'll be over 1,500, 1,800, something like that this year. So
Amazing.
it's sort of taken on a life of its own, which is always nice. And again, I get a lot of the credit with Dr. Brian Beisman, who's an oculoplastic surgeon here, but we got a great team, as you know, the team.
Yes, you do.
Who now oversee your great Science of Skincare Summit.
Yeah.
And they're great. Compass Management, for all you listening. They do a great job, and they make our lives easy, which is really nice, and seamless is all that you can ever want. So, so we run a really big educational event, and the nice part, like of ours, as is with yours, Austin is a great place to hang out.
Yeah.
And Nashville is also a great place to hang out.
I mean, but that's just one of many meetings that you direct, right? Because you direct so many internationally as well.
So we run something called the Five Continents meeting. The concept was we were going to take that to a different continent every year. Somehow we never left Europe. So we've done a couple in Asia because one of our partners is from Hong Kong. But that'll be May 27th to the 29th, or I think that's it, in Lisbon, Portugal. So it's called the 5cc meeting. And that's in its 17th year. And then I run an international nonprofit group called DAZZLE. It's the Dermatology, Aesthetics, Surgical International League. And we take that meeting everywhere around the world. So we just finished in November in Hanoi. And this is like year 15 or 16 for that. And then in October, we're going to be going to Cape Town.
Yeah.
And we'll have some fun there too.
Oh yeah, I'm excited to go to Cape Town. That's going to be an amazing meeting as well. So as you can tell, Dr. Gold is a man of many talents and not much sleep, because he does so much. He shows me his calendar at meetings and it raises my blood pressure. I have no idea how he keeps up with it.
It's all on paper. It's all on paper. It's not on the phone or anything like that. You got to keep it all on paper.
Well, we are going to talk today about one of Dr. Gold's interests, and that is dermal fillers. He is a true international expert. He's expert in many things, but we decided today to really focus on dermal fillers because not only does he know all about them and lecture on them, he does all the clinical trials, he lectures internationally, he knows what's coming from other countries and what's happening in other countries. So I just thought there's no one more perfect than Dr. Gold to really talk about this for our audience. So thank you again for being on.
Thank you for having me.
Let's jump in. I mean, I think if you look at what's happening in the United States, our most recent filler that was new was Dermavive, right? The booster, or Skinvive, I should say, the booster.
Skinvive, right. And that's an interesting thing, interesting filler, because that was the first of the fillers in the US that looked at what we call skin quality, right? Small, injections that that's a hyaluronic acid, and we know hyaluronic acid benefits the skin quality, and their clinical trials prove that point. And I think that's interesting. And if you look at the history of these skin boosters, there are lots of them, right? And the first one was actually a Galderma product, which was called Skin Booster. And it never came to the US for whatever reason. It was just not the right time to bring that product to the US. FDA had a hard time at that when it first came out 10 or 15 years ago now, trying to figure out how to develop scales and so forth. I always tell people, and you understand this, we have lots of fillers in the United States, whether they're HA fillers, hyaluronic acid fillers, whether the biostimulatory fillers, which we have two. And we'll maybe talk about an adipose-derived filler product as well. We have a lot of fillers, but compared to the rest of the world, we have very few fillers. And so depending on where you live and what the regulatory authorities have allowed, I used to show a slide when I lectured. At one point, I think we had like 10 fillers in the US and there were 300 fillers available in Europe.
Yeah.
Right. If you go to the Asian market, triple that, right? As far as the number of available fillers. That all sounds good. But coming to the US is a lot harder. We are so much more stringent in allowing filler products to get through the FDA. Actually in Europe now, it's almost becoming as hard. So for years and years and years, we used to say in the US, it's safety first, efficacy second. And in Europe, it was get the products out and worry about safety later. And a lot of those products went away because adverse events, ingredients that weren't appropriate, whatever it was. And then the European Union regulatory bodies changed all the rules. So it forced all the filler companies to go actually, if they didn't have clinical work behind them, they had to prove to the European Union that they were not only efficacious, but they were safe. And so that was actually a good thing. Many docs, boohoo the FDA and all what they do, and you do clinical trials and I do clinical trials. FDA is there for a reason, right? Yep. It's to protect the patient and to do safety. So again, it may be harder and it may be more expensive to get a filler developed in the US, but for the 99.9% of the time, we know it's going to be a safe product.
Yeah.
And I think that's really important.
You mentioned the adipose-derived filler, which is a really interesting product, Renuva, right? And so can you just talk to us about that, Michael? And you were involved, and it's just so different than anything we've got.
Yeah, so Renuva is they don't actually call it a dermal filler. It's an acellular adipose-derived matrix. It comes from a company, and I will use the name here because it's a little bit of a story. The Musculoskeletal Transplant Foundation, which is the world's largest tissue bank, and they're based in New Jersey. And about almost 10, 12 years ago, I got a phone call when I come visit them because they have the donor that is donating their body, their whatever, and it's all about the maintaining the integrity and the sanctity and everything. So less than 2% of the tissue that they actually get actually goes out into the marketplace. My wife is a beneficiary of an MTF graft in her ankle, and so it becomes a little more personal. But they had all these things, and the fat component that were donated were not being utilized. And somebody said, we might as well think about that. And so over the course of a tremendous amount of clinical work that they did in-house, and then through what we've done with them through our clinical studies, they've shown that we can take this adipose matrix, inject it in places that have volume loss, and over time, it turns from a acellular matrix. It has all the growth factors for fat and for blood to turn into fat. And it's not overgrowing and all that. And I now have patients 8 years out, 9 years out, that have done really well with scars and with depressions that we've taken care of. But it can be used on the face. It can be used on the hands. It can be used on the buttocks. I stick to the face and hands. People, will do other things with it, but it's a remarkable product if you haven't ever tried it or used it. And I think, more power to the company that they have created a whole derm and plastic surgical unit now that actually goes around and we teach this product. It's only available in the US and in the UAE, which is also interesting.
That's interesting.
And I've give courses on this all over the place. And I think, again, once you get your hands on it and realize what the benefits are, it becomes something you want to use and you see the benefits in your patients.
Yeah, you introduced me to this product, and it's really, it fits right in with the idea of regenerative medicine, which is kind of
Hmm.
where derm is going, and especially aesthetic derm, because it really impels the body to produce more fat, and so it's regenerative in that way. And as you said, growth factors, and just to remind people, it is acellular. This is not, you're not taking tissue for someone with their DNA and their signature cells. None of that. It's purely acellular. So
Hmm.
it's so interesting because that is kind of biostimulatory regenerative. And then we also have Sculptra, for example, and PMMA products. And what do you think about those, Dr.
Well,
Gold?
we've got a lot. So in the U.S., obviously, we have sculpture, PLLA.
Mm-hmm.
Outside of the U.S., there are a lot of these PMLA, PRNA,
Mm-hmm.
or LA, and there are a bunch of these that are sculpture-like, if you
Okay.
will. I've heard rumors that there's going to be another one trying to enter the U.S., so
Mm.
we'll see what that is all about in the PLLA world. These are biostimulatory products. I think the biggest hurdle that Sculpture had to overcome at the beginning, it
Yeah.
was easier to come to the US as an HIV lipoatrophy filler or biostimulatory product. And those of us that did the trials and then took care of these patients, we saw this amazing benefit, right? And then a couple of years later, the cosmetic indication was approved. I think what we've learned about Sculpture over the years is the way we can change the dilutions, right?
Mm-hmm.
We used to have to put a certain amount of this, say, and then we had to wait, keep it overnight.
Yeah.
We now dilute it a lot more. We can use it immediately after we reconstitute it. And again, I think what the strengths of these companies have been is the science behind them now, right? So again, we were just going, okay, well, here it is. And we have so much data on how PLLA and the other biostimulatory fillers work, producing not only collagen and elastin and improving the skin quality, but how well they last. And I
Yeah.
think that's really helpful for our patients and for us as clinicians to know that, yes, it's not a new product, but there's so much new about it.
More
Um,
science.
yeah, and
Mm-hmm.
again, changing the label was important for them, and so we have
Mm-hmm.
all that stuff. The other biostimulatory product, obviously, we have is Radiesse or calcium hydroxylapatite, and it has also undergone a whole transformation, right? When it first came out, and you're too young for this, but everybody said this: we're injecting bone, right?
That's
And
right.
and then David Goldberg actually did the first study looking at the transformation of calcium hydroxylate into collagen 1 and type 1 and 3. But since then, I mean, again, the stimulatory benefits of this and how it can work. So it's a great product. Again, we use diluted Radiesse a lot and in different concentrations to treat outside the face, with the face. And again, I think the kudos to the companies that have done the work to show us the best ways, the best injection techniques for this. And our patients are much happier now with
Yeah.
how we use these products. So what's out there, so you know what's coming, right? So there are several European, Middle Eastern companies that are now owned by us in the U.S. Not me, but companies in the U.S. I wish it was me, who have decided, okay, let's take the calcium hydroxylapatite and mix it with hyaluronic acid,
That's
right?
right.
And so we get the initial benefit of an HA that'll go away over time, and then we get the long-term effects of what the calcium hydroxylapatite can be. It's they're available around the world, right? They're not available in the US, and we're just waiting for clinical trials to start. I think some of the companies are dealing with, how do we determine what's, to me personally, I don't know why they haven't started
Yeah.
yet.
It's frustrating.
As somebody who does this work like you,
Mm-hmm.
if something goes wrong in a clinical trial, is it the calcium hydroxylapatite, or is it the HA, or is it the combination? And I think in my brain, that's sort of what we're trying to figure out with the FDA as so we can move ahead with these trials. But there are several companies that are really good companies that are trying to bring these products to the U.S.
Yeah.
And again, that's the Euro world. In the Asian world, they already also exist, and so that's good. There's another product coming from Europe that has. I'm just drawing a blank on its name, but it's Alonce is the brand name.
Okay.
And it's a fascinating biostimulatory product because in Europe they call them 1, 2, 3, 4, and 5,
Mm-hmm.
right? And they're spheres that basically turn into biostimulatory agents that create new collagen.
Wow.
But if it's at 2 years it turns off.
Okay.
At 3 years they turn off.
So the number corresponds to when it turns off.
Right. So
Okay.
if you want something to last 2 years, you're going to pick number 2, right?
That's incredible.
And so there was always this thing of coming to the U.S. And again, I think that we finally have the green light that at some point in maybe 2025 or 2026, we're going to be able to start testing this product in the United States. But again, globally, it's already out there.
Okay.
And so those are really good. We do have a permanent filler in the U.S. called Belafil.
Mm-hmm.
It is, it's good, and it's got an FDA approval for where we want it, but also for acne scars. You got to be very careful. It's permanent, right?
Yeah.
So, but in the right hands, in the right indications, it works really well. In the wrong hands, I've had people come to me that had injections under the eyes and tear troughs.
Where it
It's
shouldn't
not
go.
there's certain places you don't go, right? And
Mm-hmm.
if you know the do not go places, it's perfectly safe as well. So that's really good. I think the other thing that I really want to stress, there are a lot of fillers in Asia. China has a whole bunch. South Korea has a ton.
Yeah.
A lot of them are going to be, especially from Korea, will be coming to the United States at some point. Again, they have HAs, they have the PLLAs and PLRN, all those different initials coming
Yeah.
with it for biostimulatory purposes, and the calcium hydroxylapatites. In order for a company to come here to the U.S., they have to have what's called GMP, good manufacturing process, or that's approved in the U.S.
Mm-hmm.
Right? And so a lot of these companies, all the Korean companies, for instance, they all have Korean GMP.
Mm-hmm.
Getting U.S. GMP, again, is an FDA mandate in order to come here. So we've had companies come up to us and say, hey, Dr. Gold, we want to bring our products to the United States and we want to start the trials in a month. Well, the first question I would ask them is, well, tell me about your GMP.
Yeah.
Not tell me if your product works or not. I want to know about GMP. And again, they go, well, we have Korean GMP. And I have to explain to them that's not US GMP.
Yeah.
And that can put people back a year or two.
Oh, I can imagine. I mean, especially to get the FDA just to inspect what they're doing over there could take time,
Correct.
right?
And the time that it takes to make it the facilities, and most of these companies have to build new facilities, right?
Wow.
That
So the
that
investment.
meet the standards of the US FDA.
Yeah.
But again, that's all exciting because they're all, not all, but a bunch of them are actually doing that now, and so that's good. I think that will only enhance the market over time. I hope it'll enhance the market over time. I think that, again, going back to what's coming, there's European products that are coming here from very sound companies that have been around for years and years and years. They have to go through the same hurdles, though, of getting with the FDA and registering the products, going through the clinical trials here in the U.S. And if you're a skin quality filler, getting the scales appropriate that the FDA will allow. So there are skin quality scales, like we talked about Skin Vive at the beginning, that have made it through the FDA. And there are some others that are pending at the FDA based on scales. Because they're different than Skin Vive. They're injected differently. Where Skin Vive, we put little injections.
Yes.
This is more of, there are products that you sort of just put into the skin a lot more, that hydrate really well and give an amazing effect on the skin quality, and they're in Europe and around the world, but we're just waiting, right? And it's just going to take a little bit of time. But once we have all this, again, the world of fillers is
Yeah, it's just
booming.
about to blow up, isn't it? I mean, it's interesting to think about the dichotomy of the skin weave, which is injected so superficially. It's not cross-linked HA that just gives you an immediate hydration effect, because that's what HA is, right? It's a humectant. It absorbs a ton of water, so you get this great dewy complexion for 3 to 6 months, and then it slowly wanes. And then you've got Sculptra, which is PLLA, polylactic acid. It's a sugar, essentially. It's what absorbable sutures are made out of this product, so we know it's safe in the body. It's injected much deeper, and yet we still get skin quality improvement even with Sculptra. And so whether you inject very superficially with HA or much deeper with the biostimulatory, it can affect the thickness of the epidermis, the thinness of the stratum corneum, how much collagen you make. It's really impressive.
Yeah, and I think again, I think over when we started the journey, skin quality wasn't on the table,
Not at
right?
all. Yeah.
And I think our patients told us, right, and the companies started to hear from the
Right.
patients as well. Yes, my mid-face hollows are better. My nasolabial folds are better.
Right.
My jawline looks better, but darn, my skin just looks better. I don't have to put, all this moisturizer on every second of the day, or, I don't have to cover the skin as much as I used to. And I mean, that was the feedback. And so once we had the feedback, the companies are understanding that. And again, lots of little injections that with skin weave. Some of the other hydrating fillers really are just going to be a couple injections
That's amazing.
that are coming, and that's exciting.
Yeah.
And again, they're available outside the U.S. We're
Yeah.
just we just have to wait our turn.
I know. We just got back from a meeting in Paris. It was a huge international aesthetic meeting called IMCAS. And if you walk the exhibitor hall, as you said, Michael, it's just full of, it's either exosome companies or filler
Yeah.
companies.
Right.
Those are the two
And
things.
right. And at least on the filler companies, for the most part, if it says it's an HA filler, hopefully it is an HA
Yeah.
filler. Some of the exosome companies that are not, again, they're not here in the US. So the ones in the US, we know what they are because
Yeah.
that's the way it has to be. They're all US GMP. Some of them, there's another meeting called Derma Dubai
Uh-huh.
have you been to that one?
I have not. No.
So last year I went, and I can't go this year, but I've been like 5 years in a row. And there must be 250 different exosome companies there. And somebody actually bought a whole bunch of them, right? Because they sell them on the spot. And, some of them had water, some of them were saline.
Oh,
And
gosh.
so it's sort of what I tell people, buyer beware.
Yep.
If it's too good to be true, it's too good to be true.
So we don't have a lot of time left, but I wanted to cover PDRN and what your thoughts were on, Regeneron, for example, which has in the United States, they've got a topical. It's okay to apply,
Right.
but
So,
overseas, it's something that can be injected.
PDRN contains a lot of um, you know um, growth factors and other things that are actually really beneficial for the skin. The problem is they're better injected, as are exosomes for the most part.
Yeah.
But once they do that, they can't do that here. You can't inject these products because then they become drugs. The
Yes.
pathway you think fillers are complicated. That pathway is even more complicated. So we have to apply them topically. So you have to have a delivery system, really. So like a microneedling or a non-ablative fractional laser system to be able to use beforehand, which again, it just complicates the situation a little bit because it's a procedure and a topical.
Yeah.
So is the procedure doing what we want, or is it the topical?
Right.
Outside of the US, again, especially in Asia, we know these things work
Yep.
incredibly well. Then you said Regeneron, and there's Tuscany. There's a couple of these companies out there that have amazing data, right? And so for the US docs, to me, you just have to take the data and realize, okay, show me the topical data.
Yeah.
All right.
That's all we were able to use.
I work with a company in India that's called QR678, and they have probably one of the best hair growth injectables I've ever seen. But it's again, it's not here in the U.S. because again, it's injected and it's delivering the stem cells that we need to grow hair. As are these PDRNs, they have an amazing capability. So I think when I tell people their need with exosomes, with PDRNs and all this that we apply topically, we need data. We need the companies to understand what our limitations are here in the US, which is we can't inject them, period, end of story. So show me what they do topically, show me what they do topically alone, show me what they do topically with microneedling, and then go from there. But that's a hard thing because these companies, again, they have the data injectable stuff. That data exists, but you can't
take that,
extrapolate that to topical.
Yeah. And so for our listeners, PDRN is essentially fragments of DNA that is derived from salmon sperm. So every time I say that, I chuckle a little bit because it's just so odd. And so when you'll see online and on social media, people getting salmon sperm facials, for example, and what they're getting is they're using this PDRN. And as Dr. Gold said, it's incredibly regenerative, especially when injected. It's got tons of nucleotides, which make up our DNA along with growth factors and stem cell factors. And it's been shown ex-US, outside the US, to have incredible effects, especially around the eyes, from what I've heard from those who inject it quite a bit. But in the US, it can't be used that way. It has to be applied topically.
And there is one company that I work with or in discussions with. Again, they have to file with the FDA after they get a US GMP. So again, we're looking at a long time. But I do think that, again, we have two companies here that I know of in the US. And again, if people are out there listening, worth trying, because people like this salmon concept, and it's all part of what we can do. So I think that's helpful.
But again, it's acellular. There's no cells. It's fragments of the DNA. So you're really getting just the nucleotides and growth factors. And so you're not worried about, growing gills later after you apply.
Yeah, you're not going to grow anything. Yeah, that's not going to happen. But it will make your skin look a whole lot better.
There's lots of data to support that too. Well, Dr. Gold, thank you so much. We're already butting up to half an hour. And when I told you he was an expert, guys, he just spent 30 minutes telling you everything that's happening in fillers from around the world. So thank you again, Dr. Gold. He runs an amazing meeting called Scale. He also has 5cc and Dazzle. So he is everywhere all the time. My name is Dr. Ted Lain. Thank you so much for listening. Please subscribe and please tell your friends about Skincare Confidential. We so appreciate your support, and thank you.